In breaking news today, a recent epidemic is sweeping the nation, causing hysteria in dental offices across the Bay Area. Scientists are calling it the Syncope virus and are warning all dental personnel to be able to spot potential episodes before it causes further injuries. The episodes can be triggered by fear, anxiety, emotional stress, sight of blood, crowded environments, and the sight of dental instruments. Recent events have taken place here at Los Altos' Foothill College Dental Hygiene Clinic. Here we have Judy who has fallen victim to the Syncope virus. Judy, can you tell us your experience with the incident?
Hi Pia! So I haven't eaten anything that day, but I was on my 5th cup of coffee or something like that. I had a lot on my mind, but I had never passed out at a dental office before, so it was totally tragic. I don't even know what happened, TBH.
Okay then, well thank you, Judy. We also have Phyllis here with us today. Phyllis, can you recall any useful information about the incident?
Yeah, of course, Pia. So the most common precipitating factors for syncope in the dental office are stress and anxiety, and it always occurs while the patient is in an upright position. I didn't remember Judy being nervous as I greeted her, or even when we walked over to her chair. When reviewing her medical history, I asked her, "Do you feel nervous about dental treatment? Have you ever had a bad experience regarding dental treatment? Have you ever fainted?" And she replied no. At one point, I asked her if she wanted me to take her coffee cup, and she politely declined. I then started taking her blood pressure, and I noticed it was slightly elevated, but I figured it was just from her coffee.
I see, very interesting. Dr. Sakamoto, can you please provide us with more information about recognizing syncope so we can prevent further injuries when the situation does occur?
I'd be happy to, Pia.
The majority of patients who experience syncope in the dental office usually don't look as though they're nervous at all. However, as soon as they see the needle, the signs and symptoms may start to show. This includes white knuckles as they are strongly gripping onto something. On the surface, they can still continue to act normal and unaffected. But inside, they are becoming more and more anxious and apprehensive. This can manifest in different ways, including facial pallor and profuse sweating. Unfortunately, no matter how prepared one can be, syncope can still occur. So it is always best to have smelling salts close by in order to revive the patient quickly.
OMG, those salts smell so bad. What are even in those things? I think it totally burned my nose hair. Totally.
It is important to never let the patient drive themselves home afterward. Always call the patient's friend or family member to escort them home.
Richmond, Frisco, Oakland, 707. Everybody, let's go!
Will all of the HYP people please report to the dance floor? Thank you.
Said we HYP in my white tee and my black jeans and my Nikes. Said we HYP in my white tee and my black jeans and my Nikes.
Tucked in, ain't nothing changed. Sideshow dancing, whipping nuts in the rain. Got my box shirt on, fitted hat on, wave couch on, coat on. Rick Rock Beach, yeah, fella, I'll rock ya. Tripping with stress, one of the homies might pop ya. Northern California, I don't care where you stay. I'm from Fairfield.
Look at it intensely. Look at it, look scared. Okay, perfect. Are you scared? Now, pass out.
When you come to the table,
HYP, I'm HYP, man.
Juan, I think you spelled hype wrong.